Hello, good evening, good afternoon, good morning, good day, wherever you are in the world, and welcome to the Black Belt Academy of Surgical Skills. My name is David O'Regan. I'm a professor in the Medical Education, Research and Development Unit at the University of Malaya. I am a retired cardiac surgeon and the past director of the Faculty of Surgical Trainers of the Royal College of Surgeons of Edinburgh. I'm extremely grateful to the Academy of Medicine of Malaysia and Prof. Rosman Warity for supporting the Black Belt Academy and introducing us to ECHO, who are hosting our new program. Dr. Aprajita is in New Delhi. I'm live in Kuala Lumpur, and we are accredited by the Royal College of Surgeons of Edinburgh. Welcome, wherever you are in the world. We're going to pick up on where we left off last week, where we are talking about posture and how to stand properly, erect, your chin in, and line from your temple through the ear to the shoulders, elbows, hips, and knees. We did an exercise of holding your arms up in the air, and I hope you appreciate that that was extremely tiring, because as we learned, there are 17 muscles involved in supporting the scapula. The relaxed position of the arm is shoulders down, elbows by the side, and the elbows partially extended. And in this position, one's hands are palmar flexed, isolating the intrinsic muscles of the hand that enable you to effect this sophisticated grip of Homo sapiens, posing the palps of the fingers with the thumb to give you the feel of the instrument. And the feel of the instrument is what gives the surgeon the ability to dissect and determine the tissues. In this position, I pointed out last week that we had this angle, and it's this angle that we are going to visit again today. But we'll just go back and refresh. Pronation to supination for most people is 90-degree pronation and 90-degree supination. And that is why we invited you to consider holding your needle holder a bit like holding a screwdriver, because pronation and supination is the folding of the radius over the ulna, and it's a smooth movement. And we demonstrated in holding in the palm of your hand, applying the fifth, fourth, middle finger, thumb, and index finger. One is holding it a bit like a screwdriver. And to demonstrate what this means as far as rotation is concerned, pronation, supination, and we're well beyond 180 degrees. And it's important to realize that. I would ask our audience if you wouldn't mind keeping your cameras off for the moment, because I will be demonstrating some models. And what happens is that it's good to see you all, but then I can't see the screen. So you are all welcome to ask questions, put them in the chat, and Dr. Aprajita will interrupt to enable you to interact in the session. So coming back to the pronation, supination, you can see there pronation and supination. Whereas if I had my fingers through the instrument, there you go, pronation, supination, like that. Please, could we turn our cameras off? Pronation, supination, it is limited. But in doing that, you probably also saw that the end of the needle itself did some movement. Now, this is a clean movement. And this pronation and supination can happen at every angle. And you know that. when putting screws in cabinets and the IKEA flat packs. You have to get your arm in some very awkward positions to effect a clean pronation and supination. And it's that position and clean rotation that is enabled by humerus and scapular moving, so I can lift my arm up, drop my arm, etc. But this angle that I've pointed out here between the horizontal and my forearm is the displacement of the wrist from the elbow. And you can see that when my arm is in the air like that, my wrist is not displaced from my elbow. And I'll point that out as we go along, because the whole element of basic stitching turns out to be simple geometry. And I did ask you in the questions, who was Euclid? Euclid is an ancient Greek mathematician known as a geometer and logician. His birth date is unknown, and some scholars estimate it around 330 to 325 BC, but others refrain from speculating. It's presumed he was of Greek descent, but his birthplace is unknown. And he is considered the father of geometry. He's chiefly known for the Elements treatise, which established the foundations of geometry that have largely dominated the field until the late and early 19th century. His system is referred to as Euclidean geometry, and his innovation involved innovations in combination with the synthesis of theories of earlier Greek mathematicians, including Eudoxus of Cnidus, Hippocrates of Chios, Thales, and Theaetetus. With Archimedes and Apollonius of Perga, Euclid is considered amongst the greatest mathematicians of antiquity and is the most influential in the history of mathematics. Very little is known about his life, and why he's referred to as Euclid of Alexandria is he is believed to have spent most of his life in Alexandria. And the most information we have comes from scholars of Proclus and Pappus, who lived in Alexandria many centuries later. He's often confused, however, with Euclid of Megara. And Euclid of Megara is a Socratic philosopher who founded the Megarian school of philosophy and who was a pupil of Socrates in about the 5th century BC and was present at his death. He held the belief of the supreme good to be the one, eternal and unchangeable. There's some speculation about Euclid of Alexandria, the mathematician, that he studied at the Platonic Academy and later taught at the Museum. He is regarded as bridging the earlier Platonic traditions in Athens and the traditions of Alexandria. So in the Elements, he deduced the theorems from a small set of axioms and wrote works on perspective, conic sections, spherical geometry, number theory, with mathematical rigor. The Elements does not necessarily exclusively talk about geometry, and is divided into topics. There's plane geometry in books 1 to 6, basic number theory in books 7 to 10, solid geometry in books 11 to 13, although book 5 is on proportions and 10 on rational lines. At the heart of his text are a lot of theorems using Aristotle's terminology, and may be separated thus into first principles and second principles. First group, including statements labeled as definition only in the first book, including postulates, later known as axioms and common notions. The second group consists of propositions presented alongside mathematical proofs and diagrams. It is unknown if Euclid actually intended his Elements book to be a textbook, but the method of way he wrote it out fits with a textbook-like style. In addition to the mathematics, he also wrote on central topics of optics and lesser-known works, including data and phenomena. But where I think this is very relevant to surgery is very simply this. And I'm going to take you over and demonstrate a simple principle. All needles, as you can see here, no matter how big or how small, are all made on a circle.
Prof, David, kindly recenter. Can't see the middle.
Thank you. So they're all made on a circle. There you go. Small needle, larger and larger, and they're all made on a circle. When needles became circular is actually not specified. And this was the development of alloys, but essentially a round needle enables you to take a needle at depth and move it. You can imagine I would not be able to move a straight needle or stitch anything at depth. And being round and on a circle enables you to rotate the needle at depth. But in rotating the needle, it has to pass through the tissues cleanly at all stages, such that if I did a tangential section through the passage of the needle through the tissue, the suture would sit in the hole that is created. If I am not clean in removing my needle through the tissue and I skid it through or drag it out, what we end up here is a space between the suture and the path which is made by the needle. And this gap here, represented in green, that for a cardiac surgeon is a bleed, and a vascular surgeon is a bleed, but in it for a general surgeon, that is a submucosal abscess. Or in a skin suture, you've left a gap there, which is a potential source of infection. Here, behind the needle, and the basics of using the needle is to rotate it cleanly through the tissue. And there's that clean rotation, which comes from pronation and supination, but there are also angles involved. But to highlight some of Euclid's fabulous theories and why circles are important and how they're useful is just with a stick and a piece of string, here with a compass, I can create, by drawing a circle, crossing a line, and I want to draw a perpendicular to that line, make another mark, let's cross the line there, bring it up to here, cross the first arc, and then bring it on the other side, cross the second arc, and now I can join that point and that point, and there we have a perpendicular. Isn't that fantastic? To even bisect a line at a point, we can use a compass. There, change the radius of the compass, draw another mark, and then come this side, draw another mark there, and join the two lines, and I can bisect and draw another perpendicular. The relationship between perpendiculars and circles is well known in circle theorem and in Thales' theorem that states that two lines that meet the circle at the circumference from a diameter must, by definition, no matter where they meet the circumference, subtend an angle of 90 degrees. And what Euclid actually postulated and demonstrated that 90 degrees is the perfect angle. It is the fourth part of a circle. Now, for you and me as surgeons, this is extremely important, because if we want to take the needle cleanly around the tissue, we've got to make sure that We are 90 degrees to the tissue, 90 degrees across what we want to stitch, and then 90 degrees into what we want to stitch. And it's that simple, the alignment. And if we get the alignment right, then we will always be able to rotate the needle cleanly through the tissue. Not so easy, but what is fantastic is that we can now align the needle. And I put in the chat room, not in the chat room, a PDF file outlining a series of angles of 90 degrees. One from 86 degrees to 94 degrees. And I challenge you to think about which is 90 degrees. Now, I've done a study on this. We are surrounded by 90 degrees every day. You can see it very clearly, looking at the windowsills, the doors, the frames. And I believe we're hardwired to spot 90 degrees. And when I offered that series of slides that you see in the contents, 90% of people could pick out the 290 degrees without any problems, which is fantastic, because we now need to think about alignment of the needle, which is, as I said, 90 degrees to the tissue, 90 degrees across the tissue, 90 degrees into the tissue. So what does that mean? Well, to demonstrate that, I'm going to take a needle holder, all right, there, and put that on the top of the counter here, and ask you to have a look at that angle. And this is often the position that a needle is passed to the surgeon. And the first point is to know how to pick up your needle. And in doing so, we need to actually think about the anatomy of the needle. We have, at this end, the point, and we'll discuss in a later series the anatomy of the point and the fact that this is described by symbol on the packet. This end is the swage, where the thread has been put in to the end of the needle. This is a relatively new phenomenon, and Ethicon started this. And for a long time, this was the widest part of the needle at the swage. But these two are two no-go zones for picking up that area and that area. And what we have is this area, which is the working shaft. I'll come back to that in a moment, because the working shaft is, in fact, not entirely round, but it is somewhat flattened, which is important for two reasons. One, you can apply the needle driver to that, and two, as I'll demonstrate, that enables you to position the needle, and that flat bit will demonstrate enables the needle to flip in to the right position. So what is the right pickup? I've just picked that up from the table and automatically have picked it up in the near perfect position. One, it is just on the halfway. I'll describe this important element as part of the pronation and supination, because that determines where you pick it up. The second point is that there's no space between the tip and the shaft. There, that is the angle which represents which is available for you to see. As soon as the elbow is actually at the same level, in other words, if I'm sitting down, the needle will sit at 90 degrees because it is not displaced from my elbow. Okay, there at 90 degrees. Similarly, if I put my elbow in the air, my wrist is not displaced from the elbow, and then 90 degrees is appropriate. But notice when I bring it down to the table, that is not 90 degrees. It is displaced. It's off center, as you can see there. And this is important because let me demonstrate and you can hear it. Listen. The tip of my needle holder is actually hitting the plate. Listen. And you can see that the needle is off center. If I angle it out to that angle, the belly of the needle is now hitting the plate. And that belly is 90 degrees to the tissue. See that again? Even if I put it right at the end, angle it out. Okay, that's the difference. And when I said 90 degrees is the perfect angle, that's perfect because in every plane, every angle opposite in every orthogonal plane is 90 degrees, which means that you can then rotate the needle. There you go. Now, why it's also important to have it at the tip, because that little bit of area beyond the needle holder will be damaging tissue, potentially damaging tissue. It says 90 degrees across. So let me demonstrate that to you as well. What we need to be able to do, the 90 degrees is also cross what you want to stitch and 90 degrees into what you want to stitch. So I just want to demonstrate something here to you. I'm going to put a piece of cloth here, like any cloth, and you've stitched a button on a shirt. You will know in stitching a button on a shirt, if it doesn't go 90 degrees into the tissue, it doesn't pass easily through the material. If you come in at an angle, it gets stuck. So the 90 degree tissue, and a perfect example of this 90 degrees into the tissue was the Chinese diving team who scored perfect 10s in the Olympics because the swimmers entered the water without any splash. They were perfectly 90 degrees and their bodies were totally straight as they entered the water. There you go. Trying to come in at an angle, it is difficult. You can see the wap and weave of the tissue here, of the cloth, but that's the same as the tissues. You have to come in at 90 degrees. I can demonstrate this on the banana, okay? And on 90 degrees and coming at an angle there, it's tearing and skidding and lifting up the banana tissue. I'll focus down so you can actually see that. I'm coming in and it's sort of slicing and macerating the edges of the skin. Whereas if I pronate back, there you go, I'm pinpricking it cleanly into the banana. Okay? Like that. As opposed to doing that and skidding it in. And the difference is important, not only in the action of the needle, but in respect of the tissue. The banana has phenol oxidases in it. When exposed to the air, these go brown. And you can see very clearly when you've skidded the needle in or put it in perpendicular. Now, the pronation supination bit, if I use this, it'll come back out again, this protractor, and you imagine that's the center, that's the swage. Now, needles come in quarter length, 90 degrees, Okay, it comes in 3/8, half length, or 5/8. And why in eighths? We haven't quite found out. Or maybe that was the 4 cardinal winds, as I've described before. But if it's a quarter length, and I'm going to pronate it back to make sure that my needle comes in at 90 degrees, I don't have to pronate back very far. But if it's actually 3/8, I have to pronate back a bit further to make sure it's 90 degrees. If it's a half circle, I have to use the full 180 degrees of pronation and supination. But you can see here, the 5/8 needle, that now goes beyond the anatomical 180-degree pronation supination. So therefore, you need to hold it closer to the shaft. So the working shaft of the needle is, and where you pick it up, depends on your ability to pronate and supinate. If you've got limited pronation or a long needle, take it closer to the tip. Take it back, and you can find you can pinprick it in. If I'm holding it too far back on the needle holder here, no matter how hard I try, I cannot get the point to go 90 degrees into the banana. Now, the other reason to actually understand how to mount the needle is, and I found it particularly in cardiac surgery, when coming across atheromatous tissue. Atheromatous tissue is extremely hard, almost as hard as this bit of plastic here. And if I did not hold the 7/0 needle, so these geometry, as I said, applies to small needles and big needles. So even on the 7/0 needle, the geometry still applies. But if I did not hold the needle close to the point, obviously not in the no-go area of the point, I would hold it perpendicular to the atheromatous tissue, support the other side with my needle, and I could push it through without it skidding away, and I could control the pressure of the point. So understanding that your pronation and supination and the length of the needle determines where you pick up the shaft. So coming back to this important element of pointing. So we said 90 degrees across what you want to stitch. And in circle theorems, a line touching a circle, joining that, so a tangent with a radius joining, by definition, is 90 degrees. Interestingly, if you have 2 tangents bisecting, those 2 lengths are exactly the same as well. Why we use the banana model is to highlight this element of pointing. So we're going to expand on this next week as we talk about vectors. But 90 degrees across what you want to stitch. Then it's 90 degrees into what you want to stitch. So your needle is going into the lumen and coming out. Okay? And the needle comes out cleanly on the rotation, and you pick it up and do it again. But if you don't mount the needle properly, and I'm going to mount the needle like that, and I take it in there, see what happens? I'm starting to macerate the banana. And my needle holder and my needle are now being covered with banana. That is a macerated banana. And the whole idea behind this exercise is if you pick up the needle properly and point it in, you're not macerating the banana. Likewise, if you're not rotating and you're dropping your needle into the lumen to come underneath, see that? I'm actually creasing the banana. I don't want to do that either. I want to be able to take it in and rotate it out. So that is why we need to pick up the needle properly in the right position. This is in fact another of what I call splash models. As I said, the Chinese divers entered the pool at 90 degrees and there was no splash. The banana gives you a skid mark and tear if you don't point it in properly. A microwave potato with the skin on gives a wonderful method of practicing. And I'll explain why. I've drawn, first of all, health warning, a microwave potato, pick it up, is very hot. I don't want you burning yourself. Let it cool down. But before I put it in the microwave, I drew some lines. And what's interesting, when you look at anybody doing any sport where they need alignment, in golf, in martial arts, etc., they talk about posture and alignment of the feet, the shoulders, the hips. All that needs to be aligned. And the structure, as the sensei was saying on Sunday, when I was rehearsing katana again, is important. So this 90 degrees, to help my alignment and help understand, I am drawn 90 degrees on the potato. I need to rotate it back, rotate it through the tissue, and I need to come out on the line. As I'm bringing this out, note that the potato is holding the needle in position there, and it is coming out at 90 degrees. And I take it out iteratively until I reach a point, my pickup point. There you go. And I can continue the curve of the potato. And hello, see that? My alignment and pickup is maintained. So the pickup of your needle, 1, just on the halfway, 2, no space between the tip and the shaft, and 3, angled out, is key to the beginning of any and every stitch. And I can spot a good stitch before it even enters the operative field. And this now becomes an objective, observable scoring of surgical technique. Not too dissimilar to me learning how to draw a sword, where the technique is prescribed and described. And if you don't get it right, you could probably hurt yourself. So on the hurting self bit, a lot of people would probably criticize that I'm holding the needle and, oh dear, I might actually hurt myself or stick myself with a needle. Well, actually, as I'll demonstrate in a moment, you will not. And note that I'm holding it against the palp of the finger. If you want to actually mount it backhand, and I'll be flipping it backhand and forward in a moment, put it upside down and take it in at an angle. Okay? So that's picked up forehand, turn it up the other way, hold it. Note that the point is nowhere near my finger. I am not going to needle stick myself, and I can pick it up, and now it's backhand. I will demonstrate, and part of your learning as a surgeon is how to flip it forehand and backhand. But let's just revise this place, point, rotate. So place it 90 degrees across what you want to stitch. Point it 90 degrees into what you want to stitch and rotate it. Place, point, rotate. Place, point, rotate. Place, point, rotate. Note that I pick it up again. I did not use my forceps to pick it up because the needle is being held in the perfect position by the tissue. To demonstrate that again, it is coming out of the tissue at 90 degrees. There you go. Coming out, and I'm going to pick it up. At that point, continue the delivery on the rotation, and look, I've got the perfect needle mount again. I have not interfered with that with the forceps. I have not needed to reposition my needle. And the whole thing about stitching is not stitch, 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 stitch. It's set up, stitch, set up stitch. And the learning, sadly, is the set up all the time. And if you focus on the setup, then you will remove all unnecessary movement and allow the needle to start working for you. Now, the great thing is about the potato model I've got here is really you should put it at depth in a pudding basin, because most of us operate at depth inside the body cavity. And I'm astounded that we sit at a table as if to eat like that and practice stitching. The ergonomics are totally and utterly wrong. If I was sitting down, and I'm going to go into my horse riding Kibadashi stance, where my elbow is not displaced from my wrist, now that needle angle is correct. Okay, and I can pick it up. My elbow is not displaced. And you can see there that angle is significantly less. If I stand up, it is not in the right position. And if I try and actually take it and stitch through the potato like that and contort my body to try and move it through, what's going to happen is I'm going to start tearing the tissue and tearing the skin. The potato, being a hemisphere, gives you lots of opportunities now to think about this place point rotate, because I've got on this side away from me there another place. The camera's in the way, so I'm going to come over and rotate it out. There you go. And the needle's coming out on the line. Deliver it through, pick it up, continue the rotation out the tissue, and my needle is in the right position to do it again. That's on that side. The next side to attend to, which is a little more difficult, is to my right side. Here, I again have to work out, simply align your needle 90 degrees across what you want to stitch, rotate it back, my elbow's in the air, and I think I need to change the angle because my wrist is not displaced from my elbow. See it going 90 degrees into the banana, rotating it round, continue the rotation. Whoopsie, I've missed the line. Okay, and the thing is, and you need to actually do this not until you get it right, but until you can't get it wrong. And what's interesting with sword practice on Sunday, we deconstructed this movement and practiced. Okay, and pick it up, and I can go again. On the opposite side, okay, again, my elbow is in the air, and I have to think to myself, how am I going to align the needle? And note that as you're moving around the potato like this, I am actually changing my body position. My arm is abducted, my elbow is in the air, but there you go. Needle is coming out, delivering it on the circle. The most difficult angle then, for me, stitching the aorta between the left atrium and the superior vena cava. It's coming down to the aortic sinus there for those who want to do cardiac surgery. And this position, I call the screwdriver stitch, because I'm really up in the air. And again, have to be mindful of how I take the needle through the tissue, rotate it around, comes out, continue the rotation on the line, and I pick it up. These elements are all part of the practice that we ask you to go through in the Black Belt Academy. You can't jump into stitching without learning your body position and posture and being familiar with the angles, which now comes to a second part of our stitching phenomenon. and that is learning to control your needle. I said that the shaft of the needle is actually somewhat flat. What I should be able to do is pick the needle off the table. And I've actually got now a banana on my needle holder. So that is actually sticky and making it difficult. But I can pirouette the needle over the top. Pirouette it over the top. Forehand. Pirouette it over the top. Backhand. And what I'm doing there, I'm not actually holding the needle on the ratchet. I am holding the needle without the ratchet being on. Okay, there you go. Ratchet is off, but I'm still controlling the needle. And it's that flatbed. If you're doing this, you can feel it roll over and drop into position. Roll over, drops in position. Roll over, drops into position. So I can pick a needle up from a flat surface, and depending on the angle I come at it, I can pick it up at a shallow angle. I can pick it up at a 90-degree angle, and I can pirouette it over the top, and I can flip it over. Now, you'll find that needles, when given to you in a suture packet, are half in, half out, which enables you to come in at an angle, apply your needle holder, deliver the needle out, and hello, I'm in the right position. That's for the first pickup. You shouldn't really need to actually use your needle again thereafter, because with practice, being able to flip it over to forehand and backhand enables you to control your needle within the operative field. And I'm pirouetting it over the top. You're going to say, well, aren't you damaging any tissue? Well, I'm going to put my money where my mouth is, because on the back of my hand, I should be able to pick up the needle, pirouette it over the top, forehand and backhand, and adjust the needle. Now, I wouldn't advise you as trainee surgeons to start doing this immediately. It's a bit like my sensei saying, don't buy a sharpened katana just at the moment because you'll hurt yourself. Likewise, I wouldn't want you to start sticking a needle in yourself. But this is the level of control that I am wanting to see from a surgeon, being able to flip their needle forehand and backhand within the operative field. Because as soon as you take your eye out from there, you're losing focus. Your focus in operating is literally in that area. And if you can operate by keeping your needle in that area, you're not wasting any movement, not wasting any time. So you can say to yourself, what on earth is my forceps doing in all of this? Well, your forceps is employed doing something just as important as part of retraction. And I never ever deliver the needle with a forceps because you will interrupt the rotation as we've demonstrated. But likewise, I never mount the needle with a forceps because I can't get it at the tip, and I'm not going to be able to get the needle working for me. I don't think I've perforated my hand as yet, but that's the control. And in doing that, and lightly holding the needle holder, not gripping it, you can feel the needle flip forwards and backhand because the shaft of the needle is that oblong shape. So part of learning to operate and some of the basic skills is coming back to our banana. Then what we need to be able to do is take your needle through, place, rotate it back, point, all at 90 degrees, rotate it through the tissue, and we'll come on to the principles of stitching next week, but note the distance of entry and exit is equidistant. Take the needle out on the circle, pick it up, pirouette it, pick it up, position it without your forceps, and now come back the other side without tearing the tissue. So this then takes your stitching to a new dimension, is being able to take it in, deliver it, flip it over, and come back the other way. Now, I'm doing this on the top. As I said to you, the potato offers you 5 different positions. So the brown belt in the Black Belt Academy of Surgical Skills is being able to take your needle into and out of this potato in each of those positions 5 times, forehand and backhand, not a forceps in sight. And this is not too dissimilar to me practicing and learning the katana. The same discipline, the same rigor, the same practice, the same angles, the same explanations are there. And what's interesting, I'm going through a systematic review of OSAT scores at the moment in papers. I've looked at 564 papers. I'm down to, almost 2/3 of the way through. I'm down to 43 papers that specifically talk about OSAT scores. But what's interesting and missing from every single one is this pick up 1, 2, 3, place, point, rotate. Of course, sometimes you'll have to readjust the needle. And by hand. But focusing on your pickup, place, point, rotate, practicing that, you are actually moving from what I'd call one systolic movement to another systolic movement. And what I mean by that is taking the principles of the cardiac cycle. Systole is fixed, no matter how fast you go. Its systole is fixed. That's the curious complex. So the systole in stitching is putting the needle through the tissue. You, me, and an expert, we can put a needle through the tissue without any problem. Bang, needle through the tissue. Provided you stick to 90 degrees and 90 degrees. Exactly like that. And this is where it all comes undone. This is the diastolic interval between passing needle through the tissue and doing it again. And it's that diastolic interval that actually requires you to think about your setup. 90 degrees to the tissue, 90 degrees across what you want to stitch, 90 degrees into what you want to stitch. It is as simple as that, because that is defined by Euclid in geometry, circle theorems, and why 90 degrees is perfect, and why you, as a trainee, have now got the simple alignment of your needle. It starts with a pickup, remember. It is just on the halfway. Okay, and I'll just take you over again to re-emphasize the point. The pickup is just on the halfway. There's no space between the shaft and the tip, and it's angled out. And there, I've got my first 90-degree plane. Okay, 90 degrees. And if you come down under the camera directly, just to prove it's 90 degrees. There, 90 degrees, as opposed to not angled out, put it down under the camera. You can see there's a gap. Okay. That is what I call the belly bounce. The belly is actually touching the table and not forceps. Now, the point is, as I said, dependent on your ability to pronate and supinate. But I just want to come back to this place point rotate. There's one final nuance in this that only with practice and practicing how to take the needle through the tissue and practicing how to rotate is that as I rotate it back, I'm 90 degrees across what you want to stitch. Okay, see my wrist is in a neutral position. Now I'm going to pronate, and watch carefully. As I pronate, I am going to unlock the needle. And now point it in what I want to stitch, and I continue round. Why this is important is unlocking as I've pronated the needle to point, to place, pronate to point, and I've unlocked. Because a common error when stitching, particularly fine tissues like a coronary artery, and it even happens with a castro. Put the needle in the tissue, starting to take the needle through the tissue. I'll get the smaller needle because that's going to be big. You're starting to take the needle through the tissue. So place, point, rotate. And if I haven't actually unlocked it, now I'm actually got involuntary movement of my forearm, dropping the needle into the tissue and potentially tearing as I struggle to unlock. It is a bit like throwing a ball. And a cardiac colleague of mine, I borrowed this from Paul John, who is a esteemed cardiac surgeon, is like throwing a ball. When you throw a ball, you don't actually stop, open your fingers, and let the ball continue. It doesn't work like that. You naturally throw the ball. This is one. And what's interesting when using the katana, when you pick it up, it's one. It's one. You don't do it in stages. As you picked it up, you've cut in one. It's the same with a needle. It rotates. But you can only get it rotating if you stick to the fundamental principles of how to pick it up, the 1, 2, 3, 1 on the halfway, 2, no space between the tip, and 3, angled out. And then you adhere to the place, point, rotate. So place, pronate, unlock, point, rotate is of the stitching. Remembering that the perfect rotation is pronation, supination, that can happen at every angle. And you have practiced that now, understand how to practice that now on the potato. You are not going to be able to do this overnight. Far from it. This now requires practice. But I hope you will appreciate now that your banana is totally and utterly unforgiving and will tell you when it is going wrong. That is why it's such a good model. And my fellow sensei, Chris Cuddy, and I, and Sensei Sudaya, who's a corneal surgeon here in the Faculty of Medicine at the University of Malaya, and 2 medical students, Benish and Akash, who also want to do cardiac surgery. Benish is 4th year here in the Faculty of Medicine, and Akash is actually 5th year at King's College London. 5 raters, 94 bananas, and we have got almost a 95%, borderline 75% complete match. Wow. Thing is that the banana is going to tell you when it's going wrong. So what you're looking at here are what I call my splash models. They tell you when you don't hit the water at 90 degrees, and you're not going to get 10 out of 10, as the Chinese divers did. So we've gone through a lot of simple basics this evening, but it's these basics are fundamentally important to accurate stitching, and mastery comes by continual attention to the basics each and every time. Please, if there are any questions, welcome to answer them, and welcome to join us. No questions at all. We had a number of people pop in. Dr. Aprajita, have you got any observations? This is the first time that you have seen this.
I've done the surgery in my dental grabbed. So I had few questions, but I think I'll ask them after the session ends.
What I have found actually was rather fun is you see these little square perspex things. They bought at Mr. DIY, and they're used for putting tiles on walls. They are fabulous for sticking in your potato to reinforce the angles of stitching. So Cecilia, nice to see you. And there you go, 90 degrees across. So you can put them in at all parts of the potato. And that gives you an idea of your 90 degrees arrangements at each and every position. Now, with that principle, all you have to do is now get yourself into a position that enables you to align your needle like that, and hey, it becomes that easy, but only with practice. Any questions? Cecilia, I think you are actually on mute. I think you're on mute. Can you unmute yourself? That's it.
Good evening, Prof. Yeah,
Hi,
I back to Brunei.
you're back in Brunei. You had a safe journey.
Yes, thank you. I just started my work today. I have one question. So thank you very much. Because anytime I came to your sessions and I learned a lot, Prof. Thank you so much. And that today, yes. I have listened that they're using the model of the banana and the baked potato. So it's like anytime I cook, then I will I remember for that also.
Well, that's why I say it's
And then
sustainable surgery,
yes,
because
Prof.
this
Yeah.
can actually be used.
Yes, Prof.
I
Yeah.
got
Thank you
tried
so
as
much.
well.
It's a very good example and very the accessible the training tools. Yeah, how to use it. Yeah. My question is that when if we suture it and then sometime like some surgeons they ask us to hide the needle when we hand tie when we do hand tie, so in order to not to prick your colleagues, yeah, so like the needle and the needle holder in would you mind show us how to hide the needle?
You mean they do that and bury
Yes,
the needle?
sure.
I can appreciate why people do that, to avoid them actually sticking themselves. But I think that now putting your needle driver across the point of the needle and therefore can potentially damage it. To be honest, when hand tying on the needle, certainly hold it. If tying with your non-dominant hand, you can hold the needle out and still tie down and not get in the way. I would not advocate, certainly put it in a different position, but I would not advocate applying your needle driver to the point. Large needle is not a big problem, but certainly some of the more sophisticated taper points and machine points, some of which are very complicated and very specialized, you will damage the needle itself. So I wouldn't advocate that, no.
Yeah, sure.
We will have the details of the points and the different needles for different tissues. And we'll have a session on different sutures for different tissues as well later on.
Sure. Yeah. I think whether we have the juniors, trainers around, the trainees around, because sometimes we encountered where we were in a labor ward, like the students, they want to practice. They open up the new micro suture and then they cut the sutures and and then they practice for the hand tie. Then my heart was like pounding because it is very expensive, to cut it off.
I totally agree with you there. The thing about what I'm trying to do is, one, make our models accessible and easy. These models are what I call splash models. These exercises, all you need is one needle and a needle driver. It is my vision that everybody signing on for the Black Belt Academy gets a good set of instruments. The thing is that, as I said in the beginning, Lord Barclay Moynihan said that a surgeon should be caressing the tissues with the quietest and most delicate of movements if they're going to perform an art and not merely be a hewer of flesh. And the handling of the instrument itself needs to be very light. So palming an instrument, I can put it in my hand and take it out. The nurse can put it in my hand and I can hold it and I can put it down. I don't have to drag my fingers out at all. Certainly, if I am holding it with my fingers applied, again, I'm not grabbing it at all. And I had to smile to myself at an Instagram video that was describing how you can work and improve your grip. Two things. One, the distal interphalangeal joint was through the needle holder, and it was almost as if you're testing the grip strength of it. You do not need any force. You need lightness of touch. And I think when we're training surgeons, we actually need a fairly good quality instrument such that you can feel the tissues. Because, as we explained before, is that the instrument then becomes an extension of your hand, an extension of your fingers. And that's been mapped and demonstrated in neurocognitive studies. If you start gripping it, then you're losing that feel and you're losing that proprioception of the instruments. So I think, and it was my ambition, that the surgical trainee in the future signed on to a program such as this gets a good quality, not surgical grade instrument, but the next level down so they can appreciate the feel. Because some of the instruments and needle holders I've found feel very crude and very stiff, and you lose that haptic feel. And when you're stitching something delicate, you do need that haptic feel. Any other questions? Naima, do you have any questions?
Professor, I want to ask about when you're changing between mediums and it's about really a hepatic feel for things. How do you work through the different tissue types when you're stitching between the two different types?
By feel. And we will keep emphasizing this in the Black Belt Academy, is holding your instruments with the lightest of touch. As I demonstrated with my katana last week, you don't grip it, you feel it. And the way you hold it and it's balanced on your hand, a bit like surgical instruments, and you're feeling it at all the stages. And it's only with the lightest of touch that you can appreciate the different tissues. I explained last week that I did a fantastic cardiac operation, and I stood opposite him, and he replaced an aortic valve. Beautifully done. and all the stitching looked beautiful and meticulous. As we came off my path, the aorta did this, a bit like a postage stamp. And when I came to stitch it, I said, I better come round and try to put a stitch in. The most notable thing was with the first passage of the needle through the tissue, I had no haptic feedback at all, none. And the needle went through the aorta like a hot knife through butter. And my clinical diagnosis was confirmed on histology. This man had severe cystic medial necrosis. So unless you're holding the instruments with the lightest of touches, enough to deliver what you need to do, you're not going to get the feel. And that same applies, to be honest, to orthopedic surgery. You don't need brute force. It's all technique and angles and understanding that. Any other questions? Does that make sense? Did I answer your question, Naima?
Thank you, Professor.
Well, ladies and gentlemen, thank you to Echo. This is our third in the new platform, and it is wonderful to be able to talk to the audience and for you to answer questions directly. And it's a pleasure to actually, for the first time since I've been doing the Black Belt Academy, having progressed from a smartphone or Facebook with no interaction at all, to be privileged to be on a platform where I can see the audience and we can talk. And I'm open to challenge and questions as well. Thank you very much indeed for joining us this evening. We are going to continue the story next week as we look further on rotation and vectors and how the needle passes through the tissue. Dr. Jeffrey, good evening and welcome.
Thank you, David.
Evening, John. I see Datu Jeffrey there. Datu, I hope this has made sense. I wonder if you had any observations or questions. You're on mute.
No question. Yeah, I will present the material in front of me and the needle holder so that I can practice in line with what you are talking.
We broke up a little bit there. I'm sorry. What, can you repeat the question?
It's not a question, Prof. I wish I have needle holder. I have the banana in front of me and the suture, the needle, so that I can perform the procedure as I am listening to you.
Oh, fantastic. Does it make sense?
Yes, it does make sense.
And what I like,
Excellent presentation.
what I like about the banana, one, it's easily accessible. Two, it is totally unforgiving. And I think with surgical models, what we need is not a model that gives you instant feedback. And what I've been impressed with using this as this, we'll see later, I've used this as the black belt level. And Data, you have tried it yourself. Because you can see where it works and doesn't work as well. You can put a score to it, but it's objective. And what I found exciting when we've run this at the Association of Surgeons and Training Conference, that the students come back wanting to do it again and again and again. I don't have to ask them. They come back because they want to do it again. They can see the result of their endeavors and they're motivated to do better. What is very interesting, a master's student in cardiac surgery sought me out and said, I put him through the banana test. Didn't have to say anything. He stood back and he said, you've opened my eyes. What's interesting though, he had done martial arts and he walked away and said, I need to practice my basics. The banana gives you that feedback and it's fun. This is the stitching element. The Black Belt Academy has done this with forceps, scissors, knife, knot tying skills, and assisting skills. So we're going to take you through a journey of building up your skills as if you're building up your movements into katas and combinations as we've seen in martial arts. That is why I started the Black Belt Academy of Surgical Skills, because it's no longer see one, do one, teach one. It's no longer not like that, like this. We're now putting objective, iterative stages and defining this so you know how to improve and how to pick up. This doesn't happen overnight. And I don't expect most of our audience will be able to do this immediately either. But if you want to do it, you can set up with a banana, a needle holder, and I wish I could actually hand out good needle holders. I've got a supplier and I've tested the needle holder and I'm trying to get a contract to supply them. But you can do this on an ironing board at home, 15, 20 minutes a day. That is all that required. It's deliberate, purposeful practice. It's not 10,000 hours of just doing this, as Erickson said. You can now see specifically what it is. And what is missing, I think, is we have not taught the setup in our teaching of skills. That is how you stand, how you hold your arm, how you hold the instrument, how you mount the needle, how you align the needle. All those elements are vitally important as the very foundation of good stitching and good surgery in general.
Excellent, excellent.
Thank you very much, Doctor. That's very kind. So thank you very much indeed for joining us. I really do appreciate you being able to come on the platform. It's a real pleasure to actually see and chat to you in person. Thank you to ADCO. Thank you to Dr. Aprajita has actually put our certificate together. I'm delighted to say the Royal College of Surgeons of Edinburgh have their logo, and I must thank Professor Rowan Parks, the president of the Royal College of Surgeons, for putting his signature to the certificate, together with Professor Rosmawati of the Academy of Medicine of Malaysia. This is an accredited program, and it does carry CPD points. Our fellow sensei, Mr. Kennedy, has joined us. Good evening, sir. Any comments and observations?
No, apologies. I was busy doing something else, but I thought I'd better come and say hi to Prof. Silai.
Hi, Prof. Yeah.
See how many people have been attending, listening to the pearls of wisdom. So I'm right behind you, practicing the whole time.
Exactly. So I wish you all well. Look forward to seeing you next week. Please spread the word. We'd like to see a bigger audience. This is recorded. I'm going to download the recording and it will be on the Black Belt Academy website as it goes live very shortly. Thank you. Wish you well.
Thank you very much, Prof.
Good night and good
See
day.
you.